Hi, I'm Dr. Torres, Doctor of Clinical Nutrition, and today we're diving into something I think every patient should understand. Your basic blood work contains powerful clues about your health long before anything becomes a diagnosis. If you've ever been told everything looks normal, but you still feel tired, bloated, inflamed, anxious, or hormonal, or maybe you see little abnormalities on the labs here and there all the time, this video is for you. I'm going to walk you through your CBC, your CMP, your lipid panel, and your thyroid labs, but in plain English. I'll show you what each marker actually means, what symptoms it connects to, and what early imbalances functional medicine can detect that often gets missed. By the end, you'll know exactly what to look for the next time your labs come back and how these numbers can help guide your nutrition, hormones, gut health, and overall wellness. So let's get into it. The CBC is one of the most underrated tests in healthcare. It tells us about your oxygen delivery, immune system, and your nutrient status all in one panel. So let's break it down. Your hemoglobin and hematocrit are your oxygen carrying capacity. When these are low, you might feel tired, short of breath with simple tasks, wired but tired, cold all the time. Low levels often mean iron deficiency, B12 or folate deficiency. It could mean chronic inflammation. It's associated with heavy periods and gut malabsorption. And here's something most patients don't know. You can be iron deficient without being anemic yet. Ferritin usually drops first, and by the time hemoglobin falls, you've been depleted for months. Now, MCV and MCH, the size and quality of your red blood cells. Think of this as how well nourished your cells are. Low MCV equals cells too small, often iron deficiency or copper issues. High MCV means your cells are too large, often B12, folate, or methylation issues. A high MCV is very common and it's associated with fatigue, brain fog, people who follow a vegan or vegetarian diet, those on reflux medications like omeprazole, pantoprazole, chronic stress, people who skip meals. Now, white blood cell count is your immune system. This tells us if you are experiencing stress, immune suppression, or activation. Low white blood cells mean chronic stress, burnout, nutrient depletion, and chronic viral patterns. High white blood cell means infection, inflammation, allergies, or maybe even an autoimmune flare. Then we look at the differential. Are the neutrophils high? Think acute stress or bacterial burden. Are they low? Think chronic depletion and undernourished immune system. Lymphocytes high, we think viral patterns, allergies, and histamine issues. If they're low, we think of chronic stress, poor recovery, and gut immune depletion. When eosinophils raise, we think of allergies, asthma, parasites, and food sensitivities. This is why your CBC is not just normal or abnormal. It's a map on what's happening with your immune activity and nutrient needs. The CMP is your metabolic dashboard. It reflects your liver, your kidneys, electrolytes, hydration, protein status, and blood sugar regulation. So let's take it piece by piece. Glucose is not just a diabetes screening. Even if your fasting glucose is normal, the pattern matters. High normal glucose of 90 to 99 is often the first sign of carb intolerance, insulin resistance, stress hormones affecting your blood sugar, and mitochondrial slowdown. People in this pattern often will report belly fat, afternoon crashes, carb cravings, trouble losing weight, and fatigue after meals. Early detection makes a huge difference here. Now, your electrolytes are going to be sodium, potassium, chloride, and carbon dioxide. These reflect hydrogen mineral status and adrenal stress. So when you have low sodium, you're thinking dehydration or low adrenal hormones like aldosterone, or over drinking plain water and just diluting it too much. With low CO2 or bicarbonate, this is one of the most overlooked markers. Your body's burning through minerals needed to buffer stress and acidity. So we see this in a lot of chronic stress, inflammation, overtraining situations, with athletes, long-term gut issues, and low intake of mineral-rich foods. Now, your liver enzymes are going to be your AST, and your ALT. When those are elevated, doesn't always mean liver disease. It could be the beginning of fatty liver starting to form, inflammation, high stress, medication effects, alcohol load, and gut barrier issues like leaky gut or increased intestinal permeability. And then we have things like alkaline phosphatase. When this is low, it's strongly associated with zinc deficiency, poor stomach acid, SIBO, fat malabsorption, chronic stress, and undereating. So if ALP is low, digestion needs support. Now, albumin and total protein are going to reflect nutrient status and inflammation. Low albumin means that your body is struggling with digestion, protein intake, inflammation, or liver synthesis. This is a major root cause clue. Now, with lipids, let's talk about what it really means. Most patients are told your cholesterol is high or your cholesterol is fine, but lipids tell us far more about metabolic health and inflammation than just heart disease. HDL is considered your good cholesterol, but that's not the full story. Low HDL is often a sign of inflammation, insulin resistance, oxidative stress, low physical activity, and poor omega-3 intake. HDL is like the cleanup crew. If it's low, there's more going on than just cholesterol. Triglycerides are the most sensitive early warning marker. High triglycerides almost always mean carbohydrate intolerance, high sugar intake, stress hormones, the beginning of fatty liver, or mitochondrial overload. If triglycerides are over 100, I take a close look at cravings, stress, sleep, and metabolic flexibility. Now, when it comes to the triglyceride to HDL ratio, this is like your metabolic scoreboard, and it gives us a lot of functional insights. So under 1 to 1 means great metabolic flexibility. That's what we want. 2 to 1 means insulin resistance is trending. 3 to 1 or higher means that we definitely have some metabolic rigidity. So this ratio changes months to years before an A1C ever changes. With thyroid panels, we need to think about energy, metabolism, weight, temperature, mood, digestion, skin and hair health, menstrual cycles. Yet many patients only get a TSH, but functional medicine looks deeper. TSH is the signal from your brain telling the thyroid what to do. It can appear normal while you have symptoms. Free T4 is what your thyroid produces. When it's low, that means you could have a sluggish thyroid. Now, free T3 is what your cells actually use. This is the hormone that turns into energy. So low free T3 is often why patients say, I feel hypothyroid, even though my labs are normal. Reasons for low free T3 are often stress, inflammation, gut issues, nutrient deficiencies, and things like selenium and zinc, undereating, not enough calories, chronic illness, things like that. Reverse T3 is like the brake pedal. So a high reverse T3 means your body is blocking metabolism to conserve energy. It's often caused by stress, trauma, infection, undereating, and inflammation. And then you also don't want to forget about screening for thyroid antibodies. These detect autoimmune thyroid activity years before full hypothyroidism. You can have a normal TSH and other thyroid markers and have a very positive antibody screening. When we use your blood work functionally, we're not waiting for disease. We're catching trends early. We're looking for nutrient depletions. We're looking for digestive issues, insulin resistance, immune activation, thyroid slowdown, stress patterns. This lets us support your body before things escalate. If your labs have always been labeled normal, but you never got answers, I hope this video helped you see what's possible when we interpret them differently. This is exactly how I evaluate my patients' lab work inside my practice every day. If you want a deeper support, personalized recommendations, or help understanding your results, you can schedule through the link below. Make sure to like this video, subscribe, and share it with somebody who keeps being told everything is normal, even though they don't feel normal. I'll see you in the next video.